Hello, I'm Dr. Javier Pinilla-Ibarz, a senior member and a head of the lymphoma section, as well as director of immunotherapy in the Department of Malignant Hematology at the H. Lee Moffitt Cancer Center in Tampa, Florida. I'm also a professor in the Department of Oncological Science at the University of South Florida, also in Tampa. As hematologists, it's an exciting time to see the increasing number of treatment options for our patients. It is important that we help patients understand more about their condition and available options. Today, we are going to discuss some of the factors that we consider when developing a treatment plan with our patients. This presentation is designed to define some of these considerations and how we can best communicate them to our patients. This promotional program was developed by Teva Pharmaceuticals, and I'm presenting on behalf of Teva. I have received compensation from Teva to make this presentation. There are two main objectives for this presentation. The first is factors involved in treatment selection. Second is how we can help effectively communicate the treatment options to our patients. With treatment considerations, there are many factors we need to keep in mind. Again, this is a conversation that happens between the physician and the patient. But these factors will ultimately influence the treatment choice. The first one that we discuss is the staging. Staging tells us how advanced or how sick the patient may be, not only at diagnosis, but also after being diagnosed. Staging can tell us how the patient is responding to the treatment or the progression of the disease. Of course, we should also apply the classic staging factors. Besides that, there are important prognostic factors that include age, comorbidities, fitness level, along with cytogenetic abnormalities that may be present. Treatment guidelines and other established sources with evidence-based medicine offer support for the strategies that we use to help determine the therapeutic options we may offer our patients. Each patient may have different treatment goals because at the end of the day, we are treating chronic diseases. As a result, we have short-term consideration for initial treatment selection versus the long-term impact of how different modalities may really impact the therapeutic outcome. The product profile is meaningful. Patients ask us all the time, okay, doctor, what are my treatment options and how are they going to be delivered? In this case, how these treatments are administered is an important topic of our conversation with our patients. There is no doubt that intravenous versus oral administration and the different toxicity, efficacy, and tolerability are part of this conversation that we have with our patients. Finally, additional factors to consider include cost, insurance coverage, caregiver status, and access to the hospital or clinic, mainly because many of our patients are older. So let's start to dive into more detail about different considerations when discussing treatment options with patients. The first one is the clinical profile, which is based on three main factors: efficacy, safety, and the tolerability of the treatment. We are fortunate to have several alternatives and an increasing number of options, so that's the good news. But at the same time, we want to discuss the risk and different safety profiles that these therapeutic modalities may have. Also, we must factor in, depending on the safety profile of the drug, how the patient may tolerate different treatment options. When selecting a frontline therapy, we must consider the impact it may have on the availability of other therapeutic drugs in the second or even third line. During our discussion of these treatment choices, we should clearly communicate the potential risk and benefit of these different modalities to guide the patient to a treatment decision that is best for them. Length of therapy is a very important topic. The concept of defined versus undefined, shorter therapy versus long-term therapy, and the pros and the cons of each should be thoroughly discussed with patients. In my experience, this is an important topic to discuss with my patients because at times they may not have all the information necessary to make an informed decision. Besides length of therapy, we should discuss how we are going to administer these drugs. For example, is it going to be an oral drug? Is it going to be an infusion? It's important for patients to understand the compliance expectations that come with each mode of administration. We should also address any preconceived notions raised by the patient if they are not accurate. I already mentioned briefly about cost, which is something that more and more is part of our conversation with our patients. Unfortunately, some of these medications may have a high cost. We don't want to really choose based solely on cost, but we have to consider what we call financial toxicity that may impact the life of our patients. So I think it's important to keep in mind the type of insurance and research the coverage of different options so patients may understand the financial impact of their treatment. Follow-up is important in any kind of therapy, and we should anticipate a question we are likely to hear. Doctor, how often will I have to come to the clinic? This is important to discuss with our patients when we consider different therapies because the amount of follow-up will vary. With any medication, compliance is essential, and we should ensure patients understand how the medication is given and for what length of time. Follow-up testing may require routine visits, physical exams, and in certain cases, CT scans or PET scans to see how a patient may really be doing. We should discuss with patients any follow-up testings that may be required. So in summary, we reviewed different factors we consider in developing a treatment plan, including the staging and the efficacy, safety, and tolerability that compose the clinical profile of different treatment options. Every patient should really have a fair amount of education regarding these different considerations: efficacy, safety, the mode of administration, how long the treatment will last, whether it is fixed or indefinite, and the short and long-term treatment goals. All this should be, in my opinion, initially part of an important and comprehensive conversation so our patients understand the options they may have. Through this dialogue, we can better assess which treatment option can help give our patients the best possible outcome.